So in the Europe, first what they done a survey where this disease is more prevalent. At that time, many more laborers were being taken from the Asian countries to the Europe for different industries, and they found that this is more prevalent in the laborers. They are transported from the Asian countries. So first, what they done, they segregated all the patients, diagnosed and segregated all the patients from the community, and they prepared some leprosarium, that is called leprosarium or leprosy home and hospital. Leprosy home and hospital. In that, if any patient found to be affected with leprosy, then he is taken out from the community and he is put into the leprosy home and hospital. And those patients were being not allowed to go beyond the boundary of the hospital. They were being taken care of with all the medicines, food and everything what they need. Till their death, they were being taken care of in the leprosy home and hospital. So the transmission drastically cut down in the Europe, and there were no more transmission, and they very early they achieved elimination of the leprosy, not eradication, rather elimination of the leprosy from the Europe and America. But at that time, there was British rule in India and some Asian countries. So they also proposed the same thing. They also proposed the same thing to the people, to the Raja and Jamidar. They were there ruling the Asian, some part of the Asian country. So the British or American, what the model they done in the Europe and America, they just put the proposal before the Raja and Jamidar of the Asian countries that we can segregate first, we can segregate all the patients from the community and we will put them in a leprosarium or leprosy home and hospital, and they will not be allowed to go beyond the boundary so that the transmission will be immediately cut down. But the Raja and Jamidar, they did not agree with this proposal, and that is the whole tragedy. They did not agree. So the patients were there in the community with non-effective treatment. They are transmitting the disease. So the disease spread all throughout the Asian countries, especially India, Pakistan, Bangladesh, and these rest islands, Cambodia, Thailand, even Japan. In all these Asian countries, this disease was more prevalent. And some few leprosy home and hospital are being constructed. In, for example, in Odisha there are 3 or 4 leprosy home and hospital. In Cuttack, one was there, leprosy home and hospital, and that is existing till date. For opening of that leprosy home and hospital, Mahatma Gandhi had been invited to inaugurate the beginning of the leprosy home and hospital. At that time, Mahatma Gandhi had told, I am not so happy to inaugurate this leprosy home and hospital. Rather, I will be happy to close this. See what he told. I am not so happy to inaugurate this hospital. Rather, I will be so much happy to close this hospital. The meaning is that in the Asian countries, including Mahatma Gandhi, not anyone were agreed to segregate the patients. They were all thinking that the patients, they will live in the community, they will be treated in the community, and they will get close to the community. But the tragedy was that we did not have any effective at that time. Otherwise, we would have also eradicated the disease so early. Then thing comes. Another leprosy home and hospital is there in the Hathiwari. Hathiwari, one home and hospital is there, some around 40 acres of land, spread 40 acres of land. Just after, I think, Redapur left hand side, Hathiwari, there is a leprosy home and hospital. Another is there nearby Palesar Baripada, and third is that one leprosy home and hospital, Cuttack, Naya Bazar, Cuttack. And another more is there at Jala, nearby Khordai, Jala. So these big leprosy home and hospitals, they are still now existing, but very few patients are staying in those hospitals. So then thing comes all over the India, almost Many more patients are there. Transmission till now going on. But after invent of the NDT, multi-drug therapy, load has been decreased to a lot extent. And in about 1983, it was NDT was first launched in Odisha. Pilot project was taken in Bharatpur, Ganjam district, and I think Ganjam district. Then it was spread to all part of the India, also included in also all parts of the Odisha. By 1991, the leprosy load was about 120% per 10,000 population. 110 to 120% per 10,000 population. Jharsuguda is having 6.5 lakhs population. And one block, suppose Kirmira block 50,000 population. 50,000 population, just count 100 patient per 10,000 population. So 500%, suppose in a small block, Kirmira block, 50,000 population, how much percent will be there? Around 500%. So by rigorous implementation of the MDT, by the end of 20th century, the load came down to around 6 per 10,000 population. And by 2006 and 7, it came to 1 to 2% per 10,000 population by 6 and 7. Till from 2006 and 7, till date we are having this same status. The prevalence is around 1 to 2% per 10,000 population from 2006 to 7 to till date. In particularly in Jharsuguda, the situation whatever I told is exactly same applicable to the Jharsuguda. By 1991, there were 100% per 10,000 population. By the end of 20th century, by 2000, it was 6.4 or 6.5 something per 10,000 population. By 6 or 7, we had also, by rigorous work, we had also 1 to 2% per 10,000 population. But till date, every month around there is 15 to 20 new case detection. Every month there is 15 to 20 new case detection in our district. Now the question is, if we came down to 1 to 2% per 10,000 population by 2006-7, by this time we should have achieved elimination or eradication of the disease. But we cannot. Then what is the problem? The problem is that leprosy is a communicable disease. It is caused by a bacteria called Mycobacterium leprae, and the incubation period. Science students must be knowing incubation period. Incubation period means when a microorganism enter to the body, from that time to manifestation of the first symptom of the disease. Suppose for malaria, it is 3 to 5 days. Today, Plasmodium enter your body, after 3 days you will be having fever. But in leprosy, the whole tragedy is, it is having incubation period of around 3 to 30 years. If today entering the bacilli into the human body, maybe after 30 years the disease will be manifested. So if someone is having the age of 10 years, maybe he will be having the disease at the age of 40 or 45. And in between, we do not have any tool to detect who is having leprosy. Because leprosy, whenever there is sufficient load of leprosy in a body, then only by taking the skin smear and examination under microscope, we can find leprosy. Otherwise, we will be not the leprosy will not be found under microscope. There is no any test to diagnose the disease during the incubation period. So we are having two policies. One thing is that as quick as possible diagnose the disease. As quick as possible diagnose the disease. Whenever the first symptom of leprosy appears, our health system should be that much strong to detect each and every patient with the appearance of the first symptoms of the leprosy. And one good thing is that in around 70 to 80% of cases, the first symptom is a patch. Is a patch, a white patch over body, anywhere. It may be anywhere over the body, and it may be of any size or any number. A patch should be a patch will appear on the body in maximum 70 to 80% of the cases. In rest of the cases, there is lot damage and the patient will present with some deformities of face, hand and foot. But in maximum cases, the patient will appear with present with a patch on the body. The only important criteria for that patch is there are a lot of diseases presenting as a patch, but in leprosy, the only criteria is it should be insensitive. If by fine touch, even a fine touch, the person cannot know that something is touching to the patch or his body, then it is definitely leprosy. So it is very simple to diagnose. Very simple to diagnose. Also, sometimes it is very difficult to diagnose. But in maximum cases, it is very simple to diagnose. A painless patch over the body is most probably leprosy. And we have seen many patients who have presented early or detected early and treated with the MDT, they get cured very early. Even sometimes the patch also vanishes. If the patient is showing us after, or we are detecting him after appearance of the patch, after 1.5 years, more than 6 months, then the chances of disappearance of the patch is gradually that much decreases. If it is 1 year, then it may take very much long time to disappear the patch. But the disappearance of patch is not a thing to worry. Only thing is that if we are diagnosing the patient and we are giving multi-drug therapy, the patient, all the bacilli in his body is killed, and the patch may disappear, may not disappear in his lifetime. That is not a problem. वैसे भी कोई problem नहीं है. Then deformities in leprosy. What are the deformities? Also, something about just pathology, how it causes the damages. Actually, leprosy it is discharged from a patient in the droplets through nose and mouth, and enter into a healthy body through nose and mouth itself. Through nose and mouth, the droplet enters into the body of a normal human. After entering to the nose and mouth, we have got nerve endings all throughout our skin and mucous membrane. Very nerve endings are it is very intricate network. There are nerve endings on our skin, also in the mucous membrane. The leprosy enter to the nerve, and finally it causes damage to the nerve, so that there is skin manifestation. So skin manifestation is a secondary pathology. The primary pathology is damage to the nerve. Once the nerve is damaged, the deformity and disabilities appear. In the face, what are the deformity and disabilities? There will be nodules all over the ear, nodules, small swellings all over the ear. The pinna, this is called pinna. The ear will be thickened, and this beautiful margin, this will be distorted with the appearance of the nodules. Earlobe will be thickened. There is chance of loss of eyebrow and eyelash. There is the ala of the nose. This is called ala of the nose. This will be thickened, and this will be damaged and decreased. Nasal breeze. This is called nasal breeze. Depression of the nasal breeze. Lips may be thickened, and in the eyes there will be legophthalmos. Legophthalmos, I mean, we are naturally blinking the eyes, but when the eyelid is paralyzed, the patient cannot close the eyes. Even when he tries to close, it will not be closed. the eye will be always open, and it is open to all the dangers of the dust and everything, dust and air, everything. Gradually the eye will be damaged. For the primary pathology, primary problem is paralysis of the eyelid. Next come to hand. In the hand, what will be there? This is the wrist. There will be paralysis of the wrist. The patient cannot lift up the hand. The hand will be like this. It cannot lift up. The fingers. This is called forefinger and this is thumb. When the four fingers are paralyzed, the hand will be like this. It is called claw hand. Claw hand. Why it is called claw hand? Because it is looking like the claw of the cat and cat, lion, tiger, cat category animals. It is just like claw. This is called claw hand. This is the forefinger will be like this. And the thumb, there will be two type of paralysis. One is called jet thumb. This will be like this. This will be jet like or M thumb. In the monkeys, the thumb, they cannot lift up the thumb. The thumb is with all the four fingers. Whenever they try to hold the branches of a tree, they hold it like this, not like this. So in the thumb, there is F thumb or jet thumb. Four fingers, there will be claw hand, and in the wrist, there will be wrist drop. Likewise, in the foot, the foot will drop. Like wrist, the foot will drop. He cannot be able to lift up the foot and go ahead. So for that purpose, what the patient does, first take the normal foot, then round about the paralyzed foot and take the next. कैसे चलते हैं? Patient, suppose this foot is paralyzed, my right foot is paralyzed. What the patient will do? He cannot take the foot like this and put the foot ahead. What he will do is, he will take the foot like this and put the foot पीछे से घुमा के ऐसा लेके आगे डालेंगे. So by the pattern of walking, we can know whether he is having foot drop or not. And the toes will be like the fingers. Claw of the toes. So this is the major deformities. Now you imagine, if a person is beautifully dressed, even a newly bride, what portion of the body is visible to the public, to the community? Face will be definitely visible. चेहरा को कहाँ छुपाएगा? Face will be definitely visible. Hands will be definitely visible because he or she has to do this, and this will be clearly visible. And foot, during walking, even a bride is just standing, sari will be covering the foot. But when she will take the first step, the foot will be visible. So whatever tries one do, these three things are visible to the community, and leprosy is such a disease. This deforms this part of the body. It is there all throughout the body, but it deforms all these visible parts. And now comes to stigma. A lot of diseases are there. They do not have stigma. And probably in the last 3 days, from 2019 to 21 COVID period, probably there was some stigma, because that disease was spreading due to touching or something, touching something. If you are even touching a patient, the coronavirus can be transmitted. Except that there is no such disease that is associated with stigma of leprosy. In leprosy, the stigma arises from these deformities. ये सारे डिफॉर्मिटी के लिए ही स्टिग्मा है. गांव से जो आदमी लोग को भगा देते थे due to these things, because the deformed hands, gradually what will happen, the hand and foot of the patient is insensitive. They cannot know. Even when they hold the hot things, they cannot know that this is this much hot or like that. So gradually what happens, there will be some ulcers, and gradually the fingers will lost. It will go away, fall away. Fingers will be damaged and it will fall away. Even foot, all the toes will be damaged and gradually it will fall away if it is untreated. So the stigma is associated with this, और इसी के लिए गांव से आदमी लोग को बाहर भगा देते थे. और कोई डिजीज में ऐसा नहीं होता है। नो सच डिजीज एनीमोर। खाली लेप्रोसी में जो फेस, हाथ और पाँव खराब होता है या निकल जाता है बॉडी से, इसी के लिए स्टिग्मा इसके साथ जुड़ा हुआ है। And now the theme is end stigma, क्योंकि we have sufficient medicine, we have tool to diagnose the patient as early as possible, and we can treat the patient completely, and no any patient of the community will go to deformity and disability. इसीलिए we should stop stigma, किसी को घृणा नहीं करना चाहिए, and embracing dignity, because India is a democratic country and every citizen has the same right, whoever it may be, whoever is living on this part of the earth on India is a citizen of India, and he has got all the right to live like other people in the community. So that is the thing. We should end stigma, we should understand the disease, and we should try to solve the problem, not to hate them and throw out from the village or community to live somewhere like in a nearby railway station or bus stand or the bank of the river. We should try to understand the person, we should try to take care of the person so that he will live like a other citizen in the mainstream in the community. That should be our aim. Now you all are educated, you are going to the future of our nation. You should understand that this is also just like the other disease. We have all the tools. Only important thing is we have to diagnose the patient as early as possible and give him all the care, whatever care he needs. We have to give him all the cares, so that there will not be any deformity and disability due to leprosy, and no one will be staying in the leprosy colony or leprosy home and hospital. So that now this year we have to take the oath to end the stigma and embrace the dignity of the patients, whoever is suffering from leprosy. Thank you all. Thank you very much. Really, I am so happy to listen from all the students from the